Coming up next, joining me here in the studio is Jenni Douglas Todd, Chair of Dorset ICS. Now, Jenni is the Chair of Dorset's Integrated Care Board, or public name NHS Dorset. After beginning her career in the probation service, Jenni joined the civil service at the Home Office, where she spent 4 years becoming Director of Policy and Research for the Independent Police Complaints Commission. In the latter role, she was responsible for establishing governance of the new police complaints system. Jenni Douglas Todd, welcome to the studio. How are you?
Good afternoon. I'm very well, thank you very much, and thank you for welcoming me.
Oh, pleasure. Interesting role. Tell us a bit more about your job. It sounds fascinating. I bet you've got some stories, but tell us a little bit more about exactly what you're involved in, what your role involves.
Yes, so as you said, I'm Chair of NHS Dorset. It is the Integrated Care Board and the Integrated Care System for Dorset. And so we look to bring together services to deliver and improve on health and care for our population in Dorset. So we sit right across the health and care system, so that includes primary care, community care, local government, the voluntary and community sector, and of course the acute providers and the mental health and community services within the Dorset area.
Full spectrum then,
Full
across
spectrum.
the board, that's what I like to say. And again, you're one of our fantastic speakers today. You've got your session coming up quite soon,
That's
I believe.
right, yes.
So it's Shifting Power to Integrated Care Systems. If people want to tune into that, tell us what they can expect to get out of that session.
Well, I would say it's definitely the thing to watch, because integrated care systems is what we're about now. Primarily that's what NHS Confederation is supporting. It is actually looking to think about how do we help the public to look after themselves. How can we bring about the prevention agenda so that we are spending less on acute services and that people can take responsibility for their own health. So that's what it's about. And what we're trying to think about, we know at the moment that the vast majority of the money, the vast majority of the political attention, the vast majority of the resources sit in the kind of big acute hospitals, and we've got one in Dorset. But actually, if we want to be more efficient and effective with care, we need to shift that balance. And so it does mean shifting some of that to primary care, shifting some of it to community care, and also utilising extensive resources that we have in our communities around the VCSC sector, the voluntary and community sector. And the way that the whole NHS is structured at the moment obviously wasn't created for that. So this is partly about how do we change the structure of the NHS to enable ICSs and ICBs to be more effective in the role that they've got.
So is that what audience members are going to hopefully get out of your session? Is it going to be strategies to deliver that change?
Yes.
and promote that? Is there any other takeaways that you're really hoping that people take away with them?
Yeah, well, I'm hoping to give some good examples of things that we are doing in Dorset. We are leaders in some areas. So, for example, we're a leader in information and insight service, and we use that down at postcode level to really understand our population and think about what our population needs are. So I'm hoping that there will be some nice takeaways for others to think about, oh, can we do that also? So yes.
Fantastic. And I like to learn a little bit about our speakers today. Tell me how you got into healthcare originally, what was your sort of inspiration, and why you ended up where you are now.
Yeah, well, as you said, I've got quite an eclectic background, and I didn't work in health, but when I started my consultancy business, I actually wanted to do something that would keep the grey matter away. So, started looking at non-executive type work. And so I joined as a non-executive director with University Hospital Southampton in 2016, and I've kind of been in health since then, really. One of the things that interested me about that role was actually thinking about inclusion and belonging and how we could actually bring about those changes, the whole kind of EDI agenda. And so it's something I've been really interested in driving change for that time. I became the National Director for Equality and Inclusion with NHS England and left that in June 2022 to take up the role as chair of University Hospital Southampton, alongside my chair role of the Dorset Integrated Care System. So I guess my interest in health, I'd always kind of worked in the public services, particularly in policing, so lots of interaction with health. And so it kind of just made sense to try and get in, understand a bit more about it and think about the things that we could do to try and help bring about some of those changes.
So in terms of when we look at innovations and changes within sort of healthcare, how can, or do you have any suggestions how we can make sure in healthcare changes are made accessible and in an equitable way, keeping in line with the ethos of the NHS overall?
Yes.
Like, do you have any sort of tips in people looking to implement those changes to make sure they are accessible?
So I think one of the things I would say is around insights and information. So really understanding populations, because I think if we can do that, we can then take our services to where that need is rather than where people want them, if that makes sense. Because often the need is with people who we don't see as often, who aren't as engaged, draw more on those services, but actually the services aren't designed for them. So I would say that's the first thing that we need to do, really understand our communities and the data that sits there. So an example of that was that when we were looking at vaccinations in 2020, ahead of the COVID vaccination coming out, we were looking at flu vaccinations. What we found was that if you lived in a deprived area and you had multiple health issues, you were least likely to take up your flu vaccination compared to somebody that lived in a wealthy area and did not have any underlying health issues. And of course, it's the converse that should be true. So we were able to work with our GP services to change that around, to try and encourage people, going out to them, to design and make sure that people got their vaccination. And we did that because we knew at some point there would be a COVID vaccination, and it would likely be the same people that were not taking up the COVID vaccination. So that's why we did that. So I think it's really important to understand communities. The second thing I would say is really working with communities to bring about the change so that we are not doing things to them, but actually working with them. So our strategy in Dorset has been designed with our communities. They've told us what they want, which is very different to what we thought they might say. And then we therefore work with them to make sure we can deliver on that, and that that we keep that dialogue open for the future also.
Do you think like other areas of the country, do you think they take that approach as well? Do you think they ask rather than assume? Because like you say, it's obviously you got the feedback that possibly wasn't what you originally thought intended. Do you think that happens in other areas of the country? Or?
I'm sure it happens in some, but I suspect it doesn't happen in all. And I think in health we're really good at being, I would use the term paternal. So thinking that we know what's best for people rather than actually asking the question. So I think we need to do more of that, and that means taking off some of the shackles. It means being uncomfortable, actually, because, particularly if you're going out to reach communities that we don't often see, it means going to different places, speaking in a different way, and opening yourself up so that you're, one of the last things Amanda said on her speech today about her leadership capabilities was listening. And it really does mean that you have to apply active listening to what communities are saying. So I'm sure it happens, but I suspect not to the scale that it needs to happen.
Yeah, interesting. And in terms of people coming into the NHS now or thinking of starting their career journey into the NHS, what would you say to those people who are just sort of dipping their toe in or just beginning that career journey? Is the NHS a good career? What are your thoughts on that?
I would say it is definitely a good career. So when I was Director of Equality and Inclusion nationally, it was part of what I was doing was trying to enable the workforce to be more diverse. And the NHS does some amazing things, lots of innovation, but caring for people at their time of need, in their most joyous times, delivering exemplary surgery, and actually getting ahead on the prevention agenda. What could be better than that? And I consider it a real privilege to be working in this environment. And most people come into it for vocation, so I would say yes, definitely do that.
Fantastic. And in terms of, and I know you sort of touched on innovation there, have you seen anything here that you're like quite excited about in the future, like innovative ideas that you're like, oh yeah, that's good and that's
yeah,
coming, and we'll take that on board?
I haven't really been all around the stands at the moment, but when I walked in this morning, there was a robot following me, and I thought that was pretty cool, actually.
I've been chased by that robot. I've been chased around by that. So yeah,
I'm not sure what it
unexpected.
was meant to be doing, but
Neither
it was
was I,
me.
but it was. But yeah, say there anything that you think, oh, we'll take that away, and that's exciting for the future.
So I'll be looking around to see what there is. I think one of the things that we have to do is get into AI. Generative AI. I know lots of people are scared about it, but actually it is the stuff that's going to make some changes. So I'm hoping to see more of that today to see what things we can take back. Of course, all of these things cost money, and it's about where we then put our, where we want to invest to make sure that happens. But yes.
Fantastic. Well, thank you very much for coming and joining us in the studio today. And I hope your session goes fantastically. And thank you very much for your insight.
Thanks so much.
Fantastic. There we go. Another one of our fantastic guests in the studio.